Hey everyone, welcome to the channel. My name is Nick. I am a neurology resident. Today I wanted to make a video about running stroke codes. I'll preface this by saying that I am not going into vascular neurology. I really commend my colleagues that are. It's a crazy, cool field. So much advancements happening. You help so many people. So I'm going to give a video about why I like running stroke codes from someone that's not even going into vascular. So I think this shows my perspective. And if you're going to be a neurology resident, even if you're a med student, you'll see that neurology, at least in the hospital, is focused a lot on stroke codes. As a resident, it's like the bulk of what I would see on a daily basis. It's the bulk of what you get sometimes in the middle of the night that's waking you up. So wanted to give some pros as to what I like about stroke neurology, what I like about when I run a stroke code, what's cool about it. So when a stroke code happens, it depends on your hospital. But in my hospital, sometimes I'll get notified by EMS. So it's kind of cool already, right? Like I'm getting a page from EMS saying they like found this person, they're down, they look like they have a facial droop, they're not moving one side of their body. So it activates the stroke team. So right away, like if you're into heightened situations and that's your thing, it's not my thing, but if that's your thing, then it's kind of cool. It's like, oh wow, like someone's really sick, they're coming to the hospital and they need me to evaluate them first. So then you go down to the ER, EMS comes in, and then boom, right away you're walking up to EMS, you're saying like, what happened, what's the story, when were they normal. So there's like a lot of interaction with EMS and the paramedics, which is kind of cool. You also have to be able to interact with family. So if family's coming in, you got to talk to family right off the bat, right? Like you have to talk to them, you have to get the story. In these like heightened situations, you have to keep the family calm, you have to stay calm. So it really teaches you to stay calm in the midst of chaos, which I think is like a super useful skill for just life in general. And then they'll put the patient, you'll examine the patient quick. So you gotta, stroke codes are cool because you get really, your neuro exam is pretty fine tuned. You know what to check. You're looking at the patient, you're listening to history, you're kind of localizing where the problem is and thinking about what this could be. Sometimes it's not even stroke, right? So the patient comes in, you might have to say like, hold up, like let's not get on the CAT scan. This patient doesn't look medically stable, and there might be some like respiratory problem going on. There could be some infectious process going on. So you as the neurologist running the stroke code have to be like aware of everything else, right? Airway, um, things like that. And it's your job to say, hey, to the ER, listen, like you need to check this out first. Then when you put them on the CAT scan table at my hospital, I'm calling radiology. So now I've interacted with the patient's family, the patient, the ED, paramedics. Now I'm calling radiology. I'm telling them the story. I'm saying like, hey, this is what's happening. This is their exam. And then we scan the patient. We see on a CAT scan if what we were thinking is lining up with it. And if there's nothing on the CAT scan, that doesn't mean that there's not a stroke, right? Because CAT scan's not going to show us any early findings. So then you have to decide at that point, if this looks like a stroke and the CAT scan's normal and the patient's within the window to get thrombolytics, you're going to be giving them TPA, or in most hospitals now it's TNK, tenecteplase, and you got to get the medication ready. You got to get consent for the medicine sometimes, depending unless it's emergency situation, and then you have to give the patient this medicine. And the cool thing about running stroke codes that I like, I don't like necessarily the process, and there's a lot of chaos going on, but one, that it's taught me to stay calm in the chaos and speak to family and providers in the midst of a crazy situation. Two, everyone's kind of looking to you to lead the team, make decisions. And three, when you get the patient the appropriate treatment in the right time and they do really well, it's very rewarding. Yes, there are cases where things don't go as planned and the patient doesn't go well for them. But when everything goes as planned, patient comes in timely, you get what's needed to be done for them, then some patients do really well. And it's cool to see, right? Like it's really cool to see someone that's like sitting in front of you, they're aphasic, they can't speak, and then you either like push tenecteplase, or they get a mechanical thrombectomy, and the endovascular people come in, and then you see them the next day, and they're just like talking to you. They like kind of recounting what happened in their eyes, and to see someone that's severely disabled and almost on the verge of, possibly dying, because if there is brain swelling from their insult, and then to see them like do so much better the next day is like super rewarding. So to watch someone have such issues and then get better the next day is like remarkable, and that's what I really like about running stroke codes. I used to, like, I think when I started, I think when any neurology resident starts, you're like pretty nervous about it. You get really anxious. You're like, am I going to mess up? Like, am I going to miss it? And then I started switching my mentality, which I hope, if you're ever running stroke codes, anyone watching this, that you kind of switch this mentality like, hey, look, I know how to do this. If I was a patient coming in with a stroke, I would want a provider that knows how to do this, really cares, and just start switching that mentality for yourself that, no, it's okay. Like, I want a stroke code to come tonight. If they come tonight, it's because I'm here and I can help them, versus like hoping that no one will come in, you'll have like the easiest night ever, which, don't get me wrong, I do that all the time. But I just want to encourage you that if you're ever like really stressed out in the hospital and like scared of what could come in or anything that could come in, just kind of shift your perspective and your attitude, and say, you know what, like if someone came in, I know what I've been doing. I've been doing this. I know how to handle the situation. I know the next steps. I know the algorithm, and I'm really going to help them. And they're going to be one of those patients that's, I don't know, hemiplegic, and then the next day, like, they're moving their extremities like equally. So wanted to encourage you with this video. It's why I like running stroke codes, and this is coming from someone that's going into headaches. So take it for what you want. But I really appreciate you guys watching the channel. Thanks for all your support, and I will see you in the next video.